Hello everyone and welcome to Rad Chat, the multi-award winning therapeutic radiographer-led oncology podcast. My name's Namanjot Anderson and I'm joined by Joe McNamara.
Hi everyone!
So we've got two wonderful guests here, one who's been on a few times already with us. Can't get enough of us, can you, Lisa?
No, actually.
But yeah, do you want to introduce yourself?
My name's Elly. I'm a current student radiographer for diagnostic radiography at the University of Exeter, and I've also been through radiotherapy myself as a cancer patient.
Lisa?
I am a patient and public engagement coordinator at King's College London, and I work with a lot of researchers, radiation researchers funded by CRUK RadNet, City of London, and Elly is taking part in a project that I'm involved in, hearing the experiences of young adults who have had radiotherapy and also some researchers as well.
So Lisa, can you tell us a bit more about the project?
Sure. So the project comes off the back of another project called Radiation Reveal, where we spoke to 10 amazing young adults about their experiences of radiotherapy, and we also brought them together with 5 researchers. And it was so successful, and there was such important messages shared that we really wanted to build on that and speak to more young adults. And the podcast, Rad Chat, is just such an amazing platform and vehicle in order to kind of raise awareness and use the patient voice to influence change, whether that's in medical practice or research. So we got some money from UCL in London through a scheme called Beacon Merceries to try and recruit and get in touch with more young adults and more researchers and record some podcasts really. And I guess this will be the first one of those with Elly, which is amazing. So that's what we're doing.
Why did you choose diagnostic radiography?
I've kind of had a look into other kind of medical professions. I had to take a year out of school for the treatment of my transplant, and then when I come back I was kind of looking into a lot of things. I had considered therapeutic, but it did seem a little bit too close to the time. It was only 2 years out of treatment that I was kind of looking for what I was going to do at uni. But it was just something that was helping other people, taking part in people's pathways through the hospital. I felt like I knew I had been in a position of patient side, so every time kind of someone comes in and you can see they're nervous, I know exactly how they're feeling, I know exactly what they're going through, and I know that I'd be able to kind of provide them with a little bit more support in that sense. And it was just kind of important to me to make sure that patient side of it was heard and they weren't obviously dealing with anything by themselves.
So Elly, can you tell us a little bit about your cancer pathway, if you feel comfortable?
So I was diagnosed with acute lymphoblastic leukemia back in November 2018 after about 6 months of back pain and weight loss. I then had the first kind of typical treatment plan, which then didn't work. So I was told that the most the best possible way to go forward was to have a bone marrow transplant in about January 2019. I then had 2 rounds of immunotherapy to set me up for my transplant, and then had a unrelated donor who's from Germany actually transplant in May 2019. But before that I had total body irradiation in preparation for it, which just kind of, we were talking a little bit more about that in simulation activities that they were doing with it, and how there's not really much information on people who've had total body irradiation. It's a lot more focused on solid tumour radiation.
Had you heard of radiotherapy before you had to have it as a treatment?
Not really, actually. Yeah, it was a bit out of nowhere. I mean, I didn't know that I was going to have chemotherapy until probably at least 2 weeks after my diagnosis. So yeah, it was a bit out of nowhere, and I hadn't really known anyone that had really had it before, so it was kind of a bit scary coming into it. Obviously, as a young person as well, it's quite detrimental on your appearance as such. So I was very aware of the fact that I was going to look different to everyone else after having radiotherapy and chemotherapy, and obviously the effect that it's going to have on my body afterwards for late effects, so like fertility and things like that, were something that they kind of threw at you at once. You're like, oh, okay, have to deal with that now.
What made you want to be taking part in this project?
I hadn't really done any form of research after I'd been diagnosed, and obviously then started my degree. So I think I'd got an email from the Ellen MacArthur charity talking about this project, and I thought, wow, I haven't actually kind of shared my experiences with anyone really, and I feel like I've come from somewhere that's a little bit of a different pathway through than most people that would have ALL. Also at an older age, so I have a little bit more comprehensive understanding of it all, and the people that I talked to were mostly parents rather than children, because I was on pediatric ward. So it's kind of nice to actually share my experiences of things with people that were my age, I suppose, and also just be that kind of voice for people that have gone through it the way I have, and also come back into healthcare as an education to practice, I suppose.
If there's anything you could change, having gone through everything that you've been through, and obviously now working towards becoming a healthcare practitioner, what would you kind of want to share? What do you want people listening to this podcast to really think about changing in practice?
I mean, most of my kind of setbacks came from GPs.
Right.
So I suppose it's more just listening to young people, making sure they know their bodies, they know what they're going through, they know that stuff is wrong. I think that's a really important part of why I was diagnosed so late, and why I then had to go through a transplant, was purely the fact that it was picked up so late on. So obviously, please, give a little bit more respect to the fact that young people do know what's going on, do know what they're going through. I think probably advocating for myself a little bit more as well would be quite important, just because I was like, oh, they told me I'm fine, cool, I'll just brush it off, whatever. So making sure I'm being a bit more an advocate for myself, and also making sure that other people are advocates for young people that are going through cancer as well.
Lisa, why do you want to engage with this project, and what are you hoping to get out of it?
I just think it's so important, as Elly said, that we speak to and hear from patients across the board, but particularly younger patients, because they can be dismissed, and often frustratingly there is still this misconception that people can be too young to have cancer, and it's just something that we need to move away from. And I think that young people have such valuable experiences to share, and ideas and inputs. And I'm coming from very much a kind of research world where I work with a lot of researchers, and I think that it's so important that they engage with patients, particularly young patients, and that people feel part of the process, because without meaning to sound too sort of I don't know what the word is, but we're all here for the same thing. Researchers are trying to make a difference, medical and healthcare professionals are trying to make a difference, people who've been through it, and I have a bit of personal experience as well. You want to share it to help others. So I absolutely love my job, and if I can help facilitate those conversations and bring people together and kind of empower young people like Elly and others to come together with researchers and encourage researchers to listen to patients and take on board what they have to say, then that can only help and be a good thing. And I also think it's so important what you've said, and I've heard it before, about just that peer support and coming together with other people. We're not all exactly the same, but just having those connections and having those people that you can talk to that kind of get it, I think is really, really important as well. So I don't know if that answers your question, but that's kind of like, I feel really lucky to do what I do, and it's lovely to meet all the different people that I come into contact with. But I think it's got to be meaningful, and it's got to be something that has an impact, and just anything that I can do to kind of help that, then that's what I'll keep doing.
Elly, how are you now? And living with maybe consequences of treatment. how you're finding life and being a student and a healthcare course is really tough anyway. How are you coping with everything?
So I've just had my 4 years post-transplant in May, so yeah, that was been kind of a really big milestone. It will be 5 years since I was diagnosed this November. So I am doing very well. I have still suffered with things like fatigue, especially early starts. I mean, this conference has also been early starts. I have kind of tried to make sure I'm, drinking a lot of water to kind of stay on top of things. I do feel like I struggle occasionally with things like back pain and just not having as much energy to do things as everyone else. In my first year of uni, I struggled to kind of take part in any of the sports because they were so far away from where I was living, and it just felt like by the time I'd got up to the campus, which was quite hilly, I was too tired to then take part in anything, I did struggle a fair bit in kind of making friends in first year, just purely for the fact that I wasn't doing anything other than going to my lectures. Being on placement has been quite beneficial, and just meaning that I can see that I can do things. Every time you do something that you weren't expecting you to be able to do, like working a 12-hour shift, everything just kind of feels like it was worth it. It feels like I've been through all of that, and I've got to that point where I can see that I'm out the other side, and it's okay. Like everything feels kind of, it's a lot like, I don't know, it's silly probably compared to what other people are just like, yeah, no, I've just done a 12-hour shift, but for me it feels so like, I've survived all of this, and I've got to this point where I can be, I don't know, as normal as I can be, I suppose, and it just feels really nice. As well, also when you have people that come through and you can see, there's someone coming in for their like 6-month scan, and you can see it and you're like, yes, that's really nice that they're going to get good news after this, and I feel very like that makes me happy in the sense of, I know someone else is going to get good news today. I'm also, I'm having good news because I'm still alive, I'm still, moving forward, and, there's been times where I've struggled with things. I've definitely had kind of side effects from not being on the right hormones, and obviously kind of different hospital trusts are in control of me. I've got 3 different trusts that all take part in my care, and sometimes they don't communicate very well. So I've been on the wrong medication for long periods of time. I've been on no medication. I've then, not known who to talk to about certain issues. That can be, that can throw up problems as well. But at the end of the day, I know that I'm nearly at my, 5 years since diagnosis, and every day that I can be, here and do things is good. Anything like that, I'm happy just purely for that reason.
Psychologically, how do you think having such extensive treatment, because you do go through an awful lot, don't you?
Yes, yeah. I think it definitely is quite detrimental to just my mindset for things, and it can be smaller things that are like, it can either go one way or the other, and it will be like, oh, I can't do this like a normal person because I've been through that, but also, why can't I do this as a normal person? And it makes you just feel very upset that you're just so distant from everyone else, especially, and being able to do things like combining with other people in a group calls about this, that that everyone else has been in the same way. And I'm about to go up to Scotland on the 12th for the Ellen MacArthur sailing trip, so that will be nice to kind of be around people that have been through the same things, so you don't feel like you need to kind of hold back a part of yourself as well. And sometimes it can be difficult telling your new friends that that's what you've been through, and if you're going through certain like scenarios and they're like, oh, come on, you can just just do it, like just walk, and I'm like, I can't. And it is difficult to kind of have to tell someone that, especially because their reactions are usually, ooh, okay, that's a bit oversharing, so it can be difficult in that way to make, like, you're meeting new people at university and things, so you will have to obviously tell, you keep having to tell people kind of, a bit about yourself, and especially with your lecturers at university as well, I have to kind of tell a new person every single time, like, oh, this is why, this might be like this is, like mentors and wellbeing advisors, you have to tell them as well. So you do have to obviously overshare to be able to get the support back that you need, which can be quite exhausting and draining at times, because you just want to be able to go through life like everyone else, but having to kind of justify everything that you're doing and why it is like that is quite tiring at times.
Thank you so much for coming on and having a chat. Lisa, you'll be glad to know you're going to make your train, but thank you so much, and we'll look forward to speaking to you again soon. Thank you.